in the X-ray spotter series, there are some particular X-rays you might get in your exam which might be very important for a DM resident. Here you can go through the X-ray. We will try to hide the name. Even in your MD medicine career, you might have come across these kind of X-ray. What is the finding here? So right upper zone dense opacities are there. It is right upper zone pneumonia. These are the X-ray which are kept along with this. Here you can easily make out here that these kind of infiltrate is so dense. So what is the diagnosis? The diagnosis is lobar pneumonia and the right upper lobe. So what are the follow-up question which is common after this? Especially in the final DM exam, these kind of X-ray are more typical whenever the patient is immunocompromised. In the immunocompetent person, unlikely you might get these kind of right upper lobe or upper zone pneumonias. In the X-ray, you will be telling as zone, upper zone, mid zone and the lower zone as per the X-ray numbering. Whereas in clinically, you will be telling as upper lobe, upper lobe, middle and lower lobe, like that you will say. So these kind of dense infiltrates, very dense infiltrates, the lobar pneumonia, it is very common in immunocompromised patient. At least in this case, if I have to tell the background, the patient is a post-renal transplant. So in the post-renal transplant, these kind of pneumonia are common because transplant is itself an immunocompromised situation because of the drugs. Okay, here the question can come, what are the organisms which are common? If you take this post-transplant infection, in the post-transplant period, it can be classified into 3. In the immediate post-transplant period, that is within the first month, then less than 6 months, then third one is more than 6 months. So the etiological agent can be varying as per the time in the post-transplant period. In the immediate post-transplant period, nosocomial infection is very common. The infection which are occurred through the hospital, especially bacterial, specifically gram-negative, like Klebsiella, Pseudomonas, this is more common. Gram-positive staph is also common. Apart from this is more common. Less common are viral and fungal. Here, viral is more common because the patient is on immunosuppressive drug. Nosocomial infection is less likely. Here the virus infections like CMV, fungal, those kind of infection. Viral is CMV, fungal infection, two separate entities. Okay, don't take, I told CMV followed by fungal. CMV also and fungal also. If the immunosuppression is more, especially if the patient is malnourished. The third category, more than 6 months, community acquired pneumonia is more common. Suppose if the patient is on immunosuppressive drugs, always think of Klebsiella, Pseudomonas, these kind of organism very common to cause. What is the typical finding? Here you will get this kind of infiltrates lobar pneumonia. Suppose if it is not responding to drugs, you have to check the immunosuppression level, you have to reduce it, you have to look for fungal or other organism etiology like viral and fungal. So the patient responds to the antibiotics, as in this case the infiltrates became milder and it became normalized. Suppose if the patient is not responding, then what other option is there? We have to proceed with CT followed by BAL if required to find the particular organism. Suppose let us take this patient or this X-ray, this typical X-ray is of a patient who is not underwent immunotransplant. Let us take in a general community acquired pneumonia. What thing to check for? Immunocompromised like HIV, hepatitis B, C. If for any reason if the patient is having chronic any infection, that is common. And one more thing to note is severe malnutrition. Malnutrition is also an important immunocompromised situation. Suppose if the patient is immunocompetent, you might see lobar pneumonia in these zones, lower zone. Why lower zone? Because of the dependent position, the lower zone pneumonia is common. So whenever you are getting these kind of upper zone, if TB is ruled out, TB, you know, upper zone is prominent because of that particular reason. You know, the oxygen that blood supply and the oxygen difference is there, that's why upper zone is common. If you take only the lobar pneumonia, this is more common in the dependent zone. If you are getting it in the upper lobes, mostly immunocompromised, it is the situation where you will get. Other question you might get is, what are the stages of this consolidation? Red hepatization, gray hepatization question might come there. Suppose if you are a DM resident, probably they might be asking CMV pneumonia, how to treat it. Streptococcal pneumonia, which organism is more common? If fungal, how to treat it? If fungal, which fungus is common? When to go for ball? What are the complications? These are all the follow-up question you might get. And this is the X-ray of right upper zone pneumonia. In this at least patient, we gave antibiotics, patient responded, and the X-ray got cleared. So here I didn't keep the subsequent follow-up X-ray. Probably I will try to keep it in a PPT while we are discussing regarding post-transplant pneumonias. Bye bye.